Complications from a collapsed lung are quickly killing Dr. Gergis's bodybuilder patient.
Usually I'm able to put in a chest tube in a controlled setting and we have time, but this guy's crashing. I gotta throw iodine on there and we gotta get that tube in now. The last thing you wanna do is cause your patient more pain.
Lidocaine?
This way we give a numbing medicine in the ribs when we're inserting the tube.
Scalpel. Tube. There we go. We're in. Suture.
The whoosh sound is the air that is now being released between the lung and the chest wall.
How you feeling, Richard?
Once you are able to put a chest tube in and get that rush of air, the patient feels instantaneous relief.
Baby, that was so scary.
So now I want to get to the bottom of how all this happened.
So we got to figure out what happened, why this is going on. You mind if I ask you some personal questions? Want me to have the others go ahead and step out of the room?
I can stay.
All right. Have you been using any recreational drugs?
A pneumothorax that isn't caused by trauma is usually caused by drugs you smoke.
Are you freaking kidding me? You're using again?
What? No, no.
Bull.
What does that have to do with anything?
Sometimes when you're smoking methamphetamine or crack or marijuana through a small pipe, it can have you pop a lung.
The reason this happens is when you smoke drugs through a small pipe, there's such resistance and negative pressure in your lung that the weak parts of your lung can rupture.
Are you serious, bro? I thought you quit that stuff.
You dirty, lying scumbag. You promised me you'd stay clean.
I suggested his friends leave, but he wanted them to stay, so I guess he got what he asked for.
I'm not using, Kelly, I swear.
Yeah, okay, I'm not falling for this one
I
again.
did a couple years ago.
Where is your stash? Where is it?
I wouldn't lie to you.
Yeah, right.
But I must admit, my patient is a bodybuilder, and in my experience, these guys usually don't use meth or crack. Once you get hooked on that stuff, going to the gym is probably not a priority. But his girlfriend is pretty convinced that he's lying, and I can see her just tearing through his gym bag.
Wait. What is that?
And I see her pull out something that's very unfamiliar to me.
The mask? It's for high altitude training, bro. It's what the big boys use.
You wear it like this? Swap out the caps for different resistance.
Ramirez, finish this up.
It's a great way to increase your oxygen carrying capacity by increasing your red blood cell count so that when you're in competition, you don't fatigue as easily.
It's got a competition in Denver next month, so 5,000 feet above sea level. We just use 2 air holes.
So you use that when you're working out?
Yeah.
Connecting the dots with this guy, it suddenly all made sense.
Yeah, go ahead.
Breathing through one of these contraptions is like having someone put their hand over your mouth and causing a gap in between. There's so much resistance that if you breathe in hard enough or long enough, you may actually just pop a lung.
Richard, it's this mask. That's what's causing all this.
You for real?
Doc, I wear one too.
Before seeing this patient in the ER, I would have never imagined that one of these contraptions could cause a pneumothorax. It just would never have clicked in my mind that this could happen.
There's some people, they have small little air pockets on their lungs that predisposes them to something like this. That's you.
See, I knew I didn't like the look of that thing.
And your sore throat. This mask, this dries you out. That's why your throat's so irritated.
I was expecting my patient to be grateful that we solved the mystery, but he just seems out of it.
Any other questions?
Yeah. Why is my neck pain getting worse?
What? His pain should be resolving, not progressing. Did I miss something?